Hello viewers, you all welcome to ABKM Tutorials. In today's class, we're going to talk about anti-hypertensive drugs. These are classifications of drugs used in lowering of the blood pressure. We all know hypertension is a persistent or constant elevation of blood pressure greater than 140/90 millimeter mercury. So for you to talk about these classes of drugs, we need to use a mnemonic here for a better understanding of these classifications of drugs. Here the mnemonic we have the A square, this is A3, the B, the C2, the D, and the V. Starting from the A now, the A here we have the alpha blockers. The alpha blockers, they are drugs or they are class of antihypertensive drugs. When administered to the body, it goes directly to the alpha adrenergic receptors to block them. And we all know alpha adrenergic receptors, they are majorly found within the arteries. And these are the places where adrenaline binds before they start narrowing the blood vessels. So a situation where this drug is administered, it means by the time adrenaline comes to bind, there's not going to be that chance for adrenaline to bind again, which will not cause vasoconstriction and also to maintain normal blood pressure. An example of these alpha blockers are doxazocine. Doxazocine is also known as Cardura. Then secondly, we have prazosin, or you call it minipress. Then we have terazocine, which is also known as I3. These are examples of drug under the alpha blockers. Then the second one, we have the angiotensin 2 receptor blockers. These drugs, they are a class of antihypertensive drugs. When administered into the body, they go directly to bind with the receptor of angiotensin 2. We all know that angiotensin 2 are potent or powerful vasoconstrictor too, and the moment they start narrowing these blood vessels, it's going to immediately shoot up the blood pressure. So these drugs, by the time they are administered to the body, they go to bind with the receptor of that of angiotensin 2, which will make the angiotensin 2 to remain useless in the body, which will not bring about vasoconstriction and also shoot the blood pressure. Example of angiotensin 2 receptor blockers are losartan, or you call it Koza. Then we also have the second one, which is valsartan, or you call it Diovan. Then we have candesartan. These are drugs under angiotensin 2 receptor blockers. Then the third A here we have angiotensin converting enzyme inhibitors. These drugs, they are also class of antihypertensive drugs. When administered into the body, they inhibit the action of angiotensin converting enzyme. We all know angiotensin converting enzyme is that enzyme that is found within the lungs that convert angiotensin 1 to angiotensin 2, which is a vasoconstrictor. So by the time you administer this drug, it will inhibit or reduce the function of this enzyme of converting angiotensin 1 to angiotensin 2, which will maintain normal blood pressure. An example of angiotensin converting enzyme inhibitors are captopril, enalapril, or you call it Vasotec. Then we also have lisinopril, or you call it Zestri. These drugs, they are drugs that belong to angiotensin converting enzyme inhibitors. When you look at it, their suffix ends with pril. And look at this suffix, they are just words. They are just similar words or the same words that ends in the drug are called suffix. Then the B is known as the beta blockers. The beta blockers, what they do by the time you administer, they are also a group of antihypertensive drugs. By the time you administer it, they go directly to the beta adrenergic receptors to bind with it. Beta adrenergic receptors, they are majorly found within the hearts, and what they do there is to increase the heart rates. By the time you administer this drug, they will bind with beta adrenergic receptor, thereby to prevent adrenaline from binding. What adrenaline does by the time they bind to beta adrenergic receptor is to increase the heart rate. And remember, when there is increase in heart rate, there must be increase in cardiac output, which will bring about increase in peripheral vascular resistance, which will bring about increase in blood pressure. So by the time you administer this drug, they go directly to that beta adrenergic receptor to bind with it, thereby preventing the adrenalines to bind. And if adrenaline fails to bind, definitely there's not going to be the increase in heart rates. And if there's no increase in heart rates, there will not be increase in blood pressure. Then example of beta blockers are propanolol, or you call it Indera. Then we have atenolol, or you call it Tamimine, and also we have Pindolol. Their suffix ends with lol, lol, and lol. These are examples of drugs that belongs to beta blockers. Then the C here we have calcium channel blockers. Calcium channel blockers are a group of antihypertensive drugs. When administered into the body, they block or they stop the influx of calcium to the heart muscles. You know, for muscles to contract, it enables the work of calcium. So, you know, heart is made up of muscle called myocardium. So this muscle must contract before heart contract. So definitely, what this drug does is to block the pathway of calcium, meaning it blocks calcium from coming into the heart to enable contraction of the heart. So by the time the pathway is blocked, there is not going to be a way for calcium to enter and even to bring about contraction of the heart. And that is why they are called the calcium channel blockers. The example of calcium channel blockers are nifedipine, or you call it Adalat. Then we have amlodipine, or you call it Novask. Then we also have isradipine. These are examples of drugs that belongs to calcium channel blockers. Then the second C here we have centrally acting drugs. Centrally acting antihypertensive drugs, they are drugs when administered into the body, they block the sympathetic nervous system directly. No sympathetic for heart to contract, for the SA node, the conductive system of the heart to work, it has to be with initiation of sympathetic nervous system. So what these drugs do is to just block the sympathetic nervous system direct, thereby to prevent the initiation of heart contraction. Then example of a centrally acting antihypertensive is metidopar and also clonidine. These are examples of centrally acting antihypertensive drug. Then the D there we have the diuretics. The diuretics, they are antihypertensive drugs used in elimination of excess fluid from the body. The examples of diuretics, we have the loop diuretics, potassium sparing diuretic, thiazide, osmotic diuretics, and modiuretics. We are going to talk about these classes of diuretics and we mention examples of drugs under it. Talking about loop diuretics, these are drugs when administered into the body, it enables elimination of fluid, and specifically it acts on the specific side of the nephron, which is known as loop of Henle. Then, example of loop diuretics are Laxis or furosemide is a good example of loop diuretics. Then we have the potassium sparing diuretics. By the time these drugs are administered to the body, what they do is to enable the retention of the sodium, the retention of potassium, and elimination of sodium. You know, for sodium to be sodium, what sodium does to the sodium has that affinity, high affinity to water in the body, meaning it attracts much water. So at this time, it needs to be eliminated from the body for not increasing blood volume or fluid volume, which will increase blood pressure. So this time the sodium needs to be eliminated from the body. And how the way in which sodium is eliminated from the body is by retaining more amount of potassium. So what this drug does is to retain more amount of potassium during the formation so that enough sodium will be eliminated, which will decrease blood volume. And if blood volume is decreased, that means the blood pressure is also going to decrease or fall. Then, example of potassium sparing diuretics, we have spironolactone and also amyrolides. Spironolactone and amyrolides are example of potassium sparing diuretics. Then the third one we have the thiazide. Thiazide are example of diuretics, are also class of diuretics. What they do is by the time they are administered to the body, they go directly to the distal, or they act on distal convoluted to retain or to eliminate more fluid out of the body. And you know, if more fluid are eliminated out of the body, definitely there is going to be decrease or drop in fluid volume, which will bring about decrease in blood pressure. So an example of thiazides are hydrochlorothiazide and indapamide. Hydrochlorothiazide and indapamide are example of thiazides. Then here we have the osmotic diuretics. The osmotic diuretics, they are example of diuretics which decrease the intracranial pressure. You know, these pressures go hand in hand in the body. We have the blood pressure, the intraocular pressure. By the time these pressures comes together, they enable other pressures in the body. Like when there is an increase in blood pressure, definitely you should be expecting increase in intracranial pressure. So this form of diuretic, when administered, they decrease the intracranial pressure. An example of osmotic diuretic is mannitol. Then we have the modiuretic. Modiuretics are a combination of two classes of diuretic that enables elimination of fluid from the body. Example of drugs that come together to form modiuretic, we have the spironolactone and amyrolides. Spironolactone, we have the hydrochlorothiazide and amyrolides. They are example of osmotic, modiuretics. Then the last one here we have the vasodilators. The vasodilators, these are a group of anti-hypertensive drugs that act directly on the blood vessels to dilate the blood vessels, or they act on the smooth muscles of the blood vessels to dilate them. By the time you administer it, it goes directly to the smooth muscles of the blood vessels to dilate them, which will bring about the widening of the lumen of the blood vessels to increase or to expand the wall of the blood vessel so that blood will move freely. And that is why giving administration of vasodilators has to be with caution. Example of vasodilators are hydralazine. When you want to administer hydralazine, it has to be with cautions. You don't administer hydralazine in quick action. Because of its quick action, you don't administer it quickly. And you have to administer it gradually just to prevent the side effect of it. So these are classes of antihypertensives, and these drugs in combinations, when you look at them, they are all used in lowering of blood pressure in one way or the other. Thank you very much.